The EINC, or Essential Intrapartum Newborn Care Protocol, is a package of evidence-based practices recommended by the Department of as the standard of care in all births for health workers and medical practitioners under AO 2009-0025, dated by December 1, 2009. It aims to ensure that health workers have the skill and knowledge to provide appropriate care at the most vulnerable period in a baby's life. Through the EINC protocol, there is a potential to decrease newborn death by at least half. Good morning, ma'am. I am Grace, your student nurse for today. I am here to help and guide you before the delivery of your baby. So how are you feeling right now, ma'am? So, your cervix is not yet fully dilated. It is only 8 centimeters. So when waiting, just relax and calm down, and please do not drink or eat kind of food before your delivery. Thank you. Take note that it is not advisable for the pregnant mother to eat or drink any kind of she will just excrete it during her delivery. In preparation for the delivery, first is to check for room temperature. It should be 25 to 28 degrees Celsius and free of air drops. I'm going to use a piece of paper. If this paper directly fell into the ground, it means that the room is free of air drops. But if it fell in the other way, it means that we need to check and close all the windows and doors. So, let's see and check. The paper fell directly into the ground, so we achieved the desired room temperature and is free of air drops. So next, we are going to check if the mother is comfortable with her semi-upright position. Mom, are you comfortable with your position right now? Thank you, ma'am. So semi-upright and autonomy position are the default position for the delivery. We're going to remove all the jewelries. The next is to check all the needed equipment. So we have vitamin K, hepatitis B, Bcg vaccination, eye ointment, and then Oxytocin injection, dry linen, bow net, and plastic clamp and instrument clamp, scissors, and 2 kidney basins. This is one. Then, perform sterile technique and hand washing. At the time of the delivery, encourage the mothers to push. Ma'am, relax. Inhale, exhale, then push. Inhale, exhale, then push. 1, 2, 3, push. 1, 2, 3, push. Grab a dry, clean linen across the mother's abdomen and arm in preparation for the drying of the baby. Then apply perennial support and control in delivering of the baby's head. Mom, 1, 2, 3, push. 1, 2, 3, push. Then call out the time of birth. Baby girl up, 1:30 p.m. For 30 seconds, truly dry the baby. Wipe the eyes, face, head, trunk and arms, legs. Remove the wet cloth and place the baby in the skin-to-skin contact. On the mother's trials and abdomen, then cover the baby with dry, clean linen. And bonnet. The purpose of skin-to-skin contact are promote mother and child bond, breastfeeding success, lymphoid tissue system stimulation, exposure to maternal flora, protection from hypoglycemia and thermoregulation, exclude the settled baby by palpating the mother's abdomen in preparation for giving of oxytocin injection IM within 1 minute after the baby's birth. The purpose of giving oxytocin injection to the mother is to prevent hemorrhage or excessive bleeding after the vaginal birth. Then palpate the umbilical cord. After the pulsation of stump, clamp the cord using stereoplastic cord clamp at 2 cm from the umbilical base. Then mute the cord gently slightly away from the baby, squeezing the blood along the umbilical cord can boost the baby's blood volume, and this may improve the baby's health. Then clamp again at 5 cm from the umbilical base. Then cut the umbilical cord just near the first clamp. Then drop the umbilical cord at the scissors. Perform the remaining steps of the active management for the next stage of labor. Wait for a strong mutant contraction, then apply controlled contraction in the uterus continuing until the delivery of the placenta. Massage the uterus until it is firm, then inspect the lower vagina, perineum for any lacerations. After the placenta has been delivered, examine and check if it is complete or if it has any abnormalities. The placenta is complete and has no abnormalities. The placenta is shocked. Clean the mother by flushing the perineum, then apply perineal pad, napkin or cloth. Check also the baby's color and breathing. The baby's color and breathing are normal. Check also if the mother and if the uterus is contracted. Mom, are you comfortable right now? Thank you, ma'am. Then, dispose the placenta in a leak-proof container or plastic bag. Decontaminate the instrument soak in 0.5% chlorine solution before cleaning, and decontaminate the second pair of gloves before disposal. The contamination should last at least 10 minutes. Advise the mother to maintain skin-to-skin contact with her baby. The baby should be prone on the mother's chest in between the breasts with head turned into one side. Also advise the mother to observe breastfeeding cues. Ma'am, so please maintain skin-to-skin contact with your baby, okay? And please be aware of the breastfeeding cues such as mouth opening, lip flicking and sucking, bringing hands to mouth, moving head as if she is looking for your nipple, clenching of fists and fingers over her tummy, bending of arms and legs, and fussiness. Support the mother and strap her in positioning and attachment, then wait for the full breastfeed to be completed. After a complete breastfeed administered, eye ointment first to protect the baby from an unknown gonorrhea infection in the mother's body. Next is your physical examination. Vitamin K 0.5 ml IM plus 2 lateralis or in the right leg of the baby. Is hepatitis B vaccination. This is to protect the baby as early as possible from any exposure to the hepatitis B virus. Hepatitis B vaccination 0.5 ml IM versus lateralis in the left leg. Lastly is Bcg vaccination. This is to protect the baby from any serious form. Lastly is the Bcg vaccination. This is to protect the baby from any serious form of tuberculosis, such as TB meningitis infection of the brain and miliary to avoid spread of infection. This is administered intradermally in the arm of the baby. Ma'am, I advise to bath your baby after 6 hours because delayed bathing provides more initial skin-to-skin contact between you and your baby. Early washing hinders curling reflex. It can also lead to hypothermia, which means that the body temperature of your baby drops below normal, but also need infection. Defect, acidosis, or brain hemorrhage, and whenever your baby wants to breastfeed, just breastfeed her. Okay, ma'am? Thank you, ma'am. In the first hour, check the baby's color and breathing. Check the mother's vital signs and massage uterus every 15 minutes. In the second hour, check the mother's baby dad every 30 minutes to 1 hour. And lastly, complete all the records.